My name is Marjan Farid. I'm the director of the Cornea, Cataract and Refractive Division at the Gavin Herbert Eye Institute, UC Irvine. And my practice is pretty broad-based. I treat patients from dry eye disease to cataract refractive, to corneal refractive, to corneal disease, and to severe ocular surface disease. So I really have a widespread range of pathologies that I manage. So one of the most important things to me is we're living in a world of innovation right now. And it's really exciting because there's constantly new technologies coming to the marketplace that are helping me to help my patients. So I have a pretty low threshold of bringing those and incorporating them into my practice, at least trying everything out, because there's so much work that goes into developing these products. I know they've been vetted very well. And so I do my due diligence to try to learn about what's new, what are the products that are out there, and in what patients will they be most useful in, what is the patient population that this will treat. And so we bring those in, we try to get educated, we try to learn from our peers and colleagues who have tried the technology and to see how that works for them in their practice, and then bring it on, try it in patients, and then go from there. Really, studies have shown that the fresh frozen or the cryopreserved amniotic membrane retains a lot of the biologics that are responsible for the anti-inflammatory and regenerative and anti-scarring properties, which I want. That's why I'm using the graft. So for me, the use of dehydrated amniotic membrane, really, I don't feel I'm accomplishing as much in terms of the regenerative and the anti-inflammatory properties. So I use the fresh frozen cryopreserved Procara for all of my cases. So my wow moment with Procara was in a patient with herpes keratitis. These herpetic patients that have epithelial disease, they often get treated with toxic ocular surface drops, and then they develop subepithelial haze and scarring, which is very particular. In a patient that came in who was having recurrent herpetic disease, I said, you know what, let's just put in a Procara, see what happens. And the patient's epithelial keratitis, not only did it heal, but there was no evidence of scarring a week later when I took out the Procara, which is unheard of for me. If I put a patient in, I'm gonna see that subepithelial scarring with the topical medications, and this, the amniotic membrane really prevented that from recurring. So that was my wow moment.